Hello, Assalamu alaikum. My name is Dr. Ashik Hussain, and I am Assistant Professor of Anatomy at Rashid Latif Medical College, Lahore, Pakistan. In my previous videos, I talked about many things um, thoracic vertebra and rib cage, and today in this particular video, I'm going to talk about muscles of rotator cuff. So this is how deep muscles of rotator cuff are present. I just removed the trapezius and the deltoid muscle, and here we can see on the surface of the scapula the muscles of rotator cuff. Now the question is why they are called muscles of rotator cuff. So these muscles are, first of all, supraspinatus, infraspinatus, and teres minor. Here teres minor, this is teres minor, and anteriorly we have got, I have to remove these muscles, and this is subscapularis. So here we can see that subscapularis anteriorly, and on the posterior aspect I just showed you, this is supraspinatus, infraspinatus, and teres minor. And these muscles are actually they are present and surrounding the upper end of the humerus in such a way that they form a continuous cuff-like structure around the upper end of the humerus. So why they are called rotator cuff? Because they rotate the humerus. Either they rotate it medially or they rotate it laterally. So these four muscles are called muscles of rotator cuff. So we will take them one by one. For example, this is supraspinatus. Here we can see supraspinatus. This supraspinatus muscle, it is present in the supraspinous fossa. It is originating from the supraspinous fossa, and it is inserted onto the greater tubercle superior most impression. On greater tubercle we have got three impressions: superior most, this superior most, middle one, and the inferior most. So supraspinatus is on one side, it is originating from the supraspinous fossa and attached onto the superior most tubercle, whereas infraspinatus, it is originating from the, as the name is indicating, infraspinatus, it is originating from the infraspinous fossa, and on the greater tubercle they are inserted into the middle impression, whereas teres minor, it is originating from the lateral border, upper part of the lateral thick border, and inserted into the inferior most impression. We will see the subscapularis in a while. First, I would like to talk about the action of this muscle. So just look at the origin and then insertion of this muscle and orientation of this muscle. Now the rule is that whenever contraction occurs or muscle contracts, muscle origin pulls the, look at the direction of fibers. In this case, origin pulls the insertion toward itself. Here is the origin and here is the insertion. So in this case, when supraspinatus will contract, its origin will pull the insertion toward itself. As a result, what's going to happen? As a result, abduction will take place. First 15-degree abduction. So supraspinatus is the initiator of the abduction. Then infraspinatus, look at the infraspinatus, it is originating from the infraspinous fossa and inserted into the middle impression. So this origin will pull insertion toward itself. As a result, this muscle will laterally rotate the humerus, and when this muscle, which is called teres minor, this is origin, this is insertion, it will be pulled. Origin will pull insertion toward itself. As a result, the humerus will laterally rotate. So this supraspinatus is supplied with the suprascapular nerve. As the name is indicating, suprascapular means the nerve is reaching the scapula from above the scapula. After supplying the supraspinatus muscle, the same nerve would supply the infraspinatus muscle. and infraspinatus muscle, and teres minor, it would be supplied by axillary nerve. When axillary nerve will leave the quadrangular space here, it would supply the, first of all it would supply this deltoid, and also supply this teres minor. So now we will talk about this subscapularis. Look at the subscapularis. It is originating from this from the subscapular fossa and inserted into the lesser tubercle. So when this origin of the muscle here comes, the origin, this origin would pull this insertion toward itself. As a result, the humerus will medially rotate. So that's why either they produce medial rotation or these muscles produce lateral rotation. So that's why these muscles are called muscles of rotator cuff. And this muscle, as the name subscapularis, it is supplied by the subscapular nerve, which is present just in front of the subscapular, muscle, subscapularis muscle. And why this muscle is called subscapularis? Because it is present just in front of the or beneath the scapula. That's why this muscle is called subscapularis. Thank you very much.